I'm Jamie Corrigan. I work at Cary Medical Center in the HR department. I'm the employment specialist. I've been here for about 5 years, starting part-time in college, and ended up landing a full-time position after I graduated. HR was definitely not in my plans, but once I got into it, I realized it was something that I really enjoyed and thought was interesting. So decided to stay, and here we are 5 years later. So I'm going to share my screen. I do have a brief presentation here. So in regards to career opportunities at Cary Medical Center, I put together a little presentation describing us, our community, and what we have for job positions. So starting right off with our vision and mission. Our vision, we are caring people committed to excellence in patient-centered healthcare and community well-being. Our mission is we aspire to create a healthier community. Our staff live by these words, and I feel that we've done a good job to show our community that we're there for them, and these words really speak to our culture here at Cary. Just a little history on us before we get into everything else. Jefferson B. Cary, he was a general practitioner here in Caribou for many years. He, after he passed, ended up leaving a portion of his estate to the city of Caribou to build a community hospital. September 5th, 1924, Cary Memorial Hospital opened its doors. In the 70s, our community's need for medical services outgrew Cary Memorial Hospital, and we ended up having to relocate our building to a larger plot of land on the outskirts of Caribou. Shortly after, Cary Memorial Hospital renamed to Cary Medical Center, which still is our name today. We're governed by an 11-member board of directors appointed by the Caribou City Council. Our city manager is always a permanent member, as well as the chairman of the Jefferson Cary estate. A little bit about Cary. We are a 65-bed acute care hospital with all private patient rooms. Some of our inpatient nursing units have recently been renovated to better suit our patients' needs. So we just recently had a renovation completed in 2017 on our acute care unit, and it came out beautifully. We plan to continue on down that road with our OBGYN unit, and as well as a few other units. Our family includes approximately 540 employees, more than 60 active medical staff providers, 100 courtesy and consulting physicians, and 75 volunteers. In collaboration with Pines Health Services, federally qualified health center, we do have services including general surgery, pediatrics, 24-hour emergency medicine, obstetrics and gynecology, orthopedics, rehab services, one-day surgery, family practice, sports medicine, cardiac and pulmonary rehab, internal medicine, urology, radiology, pathology, and a wide variety of specialty clinics. We also do have a relationship with Aroostook County Veterans and the Maine VA health system. So actually right on our campus at Cary, we do have a VA clinic. It's kind of in the back of our hospital, but it's right on site. So we do serve our local veterans here. As well, we are also connected to the Maine Veterans Home. So they are right connected to our campus, and it's been very convenient for them as well as for us. They are a 40-bed long-term care facility and a 30-bed residential care facility. For those of you who don't know much about Caribou, we are the most northeastern city in the U.S. Outdoor sports and adventure are for every season here. We have 4 beautiful seasons. We have 3 exceptional higher learning facilities, UMFK, NMCC, and UMPI. We have a variety of employment opportunities here, rural peaceful living, caring communities, and Caribou specifically just had a newly built pre-K through 8 community school that actually just opened last week. So that's just a little bit about us in case you guys were not familiar with Caribou. Back to Cary Medical Center. This is our administration team. We always like to mention them because they are the heart and soul of our hospital here. Without them, we wouldn't have a great team that we do. They provide some really strong leadership for us. Right from the top, Chris Duty is our CEO. Dr. Reagan Gallagher is our Chief Medical Officer. Leslie Anderson is our Chief Operating Officer. Chelsea DeRozier, our Chief Financial Officer. Timothy Conroy, our newest addition actually, is our Chief Information Officer. Jen Plant, and also a recent addition, is our Chief Nursing Officer. Bill Flagg is our Director of Public Relations, and Paula Parent, our HR Administrator. Our current staff and our newly hired employees, I've heard a lot recently, especially, that our administration team is very available, and they're always willing to help us out. You know, being in a rural hospital, or a hospital setting at that, is sometimes hard to come by for an administration team to be right there on the front lines with you. And I think our staff have realized that our administration team is just that. They love to be helping us right on the front lines, and they're usually always available for questions. They're great. Some of our services and departments here at Cary, we have non-clinical and clinical positions here. As you can see by these departments, we do have inpatient nursing, outpatient nursing, oncology care, pharmacy, public relations, hospitality services. There's a plethora of departments here. We do have 540 staff members, as I mentioned earlier, and all of them have a role here at Cary. You know, whether it be a hospitality services specialist, a laboratory worker, orthopedics, anything like that. We all have our role, and we help to ensure that our hospital runs smoothly. A lot of people ask about our COVID-19 response. That seems to be kind of the topic of discussion these days. So we are doing a few things to keep our community, patients, staff members, and visitors safe during this pandemic. As you can see, I'm wearing my mask, even though I'm alone in the office here. We do have to wear the masks as much as possible. Of course, exceptions are eating and drinking, things like that. Even though I'm alone, I do have to wear it. It's a requirement. We also limit our visitors. We have 24/7 screening and limited entrances for both the public and our staff. Of course, masks are required for anyone who enters the hospital. We do have a travel policy and sick policy enforced for our staff here at Cary, so that way we're ensuring they keep our patients safe. We have remote working options. Right now, our billing office is actually working remotely. Our patient account coordinators are working remotely, occasionally coming into the office to, you know, pick up things and try to maintain that social distancing and slow the spread here. We also have some new cleaning technology throughout the hospital that our hospitality specialists are using. You'll often see them walking down the hall with a sprayer. They spray all of our walls, our handrails, and doorknobs, things like that, disinfecting. We also have available testing on site. The picture to the left here shows one of our testing systems for COVID-19. So we do test our staff, you know, if they've been exposed or something like that, and we can test it here right on site, which is very nice. We're doing many other things as well that I haven't mentioned here, but we do take the pandemic very seriously. You know, being a hospital, it's a very big deal here. In regards to careers, I mentioned earlier that we do have clinical and non-clinical positions. Clinical positions at Cary can range from pharmacy, nursing, rehab, imaging, lab services, and much, much more. We not only have these positions available, but we also encourage students to come in, you know, nursing students, pharmacy students, rehab students. We encourage them to come fulfill their clinical hours here with our employee mentors. So not only do we staff these individuals, but we do help students grow here. And also job shadowing is a great way to decide whether or not a clinical position is for you. We always encourage that. The next slide will show what we have for clinical positions. Oh, I'm sorry. We'll do the on-the-job training first here. I'm not following my slides. We oftentimes get the question, do you guys have on-the-job training positions? So some people may not have gone to school for something that they're interested in. For instance, surgical technician and phlebotomy. Those are two on-the-job training opportunities that we do have where it doesn't require experience or schooling or certification or a license, something like that. We do prefer candidates to have the experience, of course. However, we on-the-job train for these two positions. So a surgical technician, that is somebody who assists in the operating room. So you can see in the picture on the right here, the individual with the colored cap, he's a surgical technician. He assists with passing instruments to the physician, to the nurse. He gets the room ready for the surgery. So we do on-the-job train for that. How it works is you would train ever so many hours, depending on how you're doing, and then you would sit for a certification exam to get certified. It's basically the same process for a phlebotomist. We don't require you to have experience, of course it's preferred, but we will train you up until you're ready to become certified. You would sit for a test and become certified. And then there's also an opportunity to further education as a phlebotomist in regards to processing. And with both of these positions, there's always opportunity for additional compensation once a certification is received or additional training is completed. So those are just two options. We do have other positions that you can on-the-job train for, but those are two of the most popular. So this is a slide that shows what we currently have open for clinical positions at Cary. You know, we have inpatient nursing, emergency room nursing positions in our imaging department. That radiology aid is actually one that is on the job training as well. We do have some CNA positions open at Lekadzi. I'm not sure if you guys are familiar with Lekadzi, but it is a long-term care facility for individuals with intellectual disabilities. So we have 9 beds and 9 residents. They live there full time. So we're currently staffing for CNAs to staff that area. Lekadzi is actually located in Van Buren. So while a lot of people think they're right on campus, they are a little bit north from us in Van Buren. As you can see, we also have opportunities in the lab, in nursing administration, our operating room, respiratory therapy, and then a couple of on-call positions there. As I mentioned earlier, we do have non-clinical positions here at Cary. We offer a wide variety of them, from billing to patient registration and housekeeping to IT. Those are just a few examples. The next slide here will show what we have currently. So as you can see, we do have a full-time position in the billing office, part-time in medical records, full-time in hospitality, IT. Currently, we're also staffing for hospital screeners. So these individuals screen for COVID-19 symptoms of any patient, visitor, employee who comes to our hospital. So we do have full-time and part-time opportunities there. We also have a PR position and then a few on-call positions. Okay, let's see. A big question that we do get while people are applying for positions is wage information. That is based on a few different things: relevant experience, certification, licensure, registration, education, and of course, internal equity. We always try to review everything along with our current staff members in similar positions to ensure that everybody is being paid a fair and equal wage. Final wages are typically reviewed by our HR administrator and manager, as well as the administrator over the position in question. So if you are interested in learning more about a wage for a specific position, please reach out to me. We can discuss the details. We typically just need to review your resume, your current experience, and then we can get you at least a range and kind of go from there. We do have a pretty comprehensive benefit package here for qualifying candidates. We do have part-time and full-time options for our employees. So anybody who has 20 hours a week or more is eligible for benefits. As you can see, we have health insurance for employee and family, medical and dental care reimbursement accounts, which is our flex spending account. We also have pharmacy prescription coverage options, over-the-counter medication purchase options, dental for employee and family, basic life insurance, employer paid coverage at 1 times our annual salary. We also have Identity Guard, which is a new benefit to us as of this year. and it is an employer paid benefit. We also have family coverage options in that area. We do have dependent and supplemental life insurance, short-term and long-term disability insurance. We have 2 retirement plans, accident and critical illness insurance, whole life insurance, and group indemnity. We also have employee discounts on hospital services and discounts on community services or products. If you guys have further questions on benefits, feel free to reach out to Doris St. Hilaire. Her information is right on this slide. She's our benefit specialist. I like to call her the expert. She can answer any questions that you guys have regarding benefits. Aside from our benefit package, we do offer some educational loan assistance. I know for some certain positions, for nurses and physical therapists, things like that, they do have questions on educational loan assistance. So we do have a program called Forgivable Education Loan Program. It's available for qualifying candidates. This program will assist you in repaying your educational loans in return for a work commitment at Cary. So typically how that process works is you would fill out an application for FELP is what we call it. I send it to the HR administrator, she reviews it, and then she meets with you to go over the details on your work commitment and how we'll repay your loans. We also offer relocation assistance. Some people are looking to move to our area, and that's something that we include or offer to them if they're interested. Typically, you would have to provide to us some receipts, so that way we can compensate you back for or reimburse you for what you had paid trying to relocate here. So how to apply? If you guys are interested in employment at Cary Medical Center, I would encourage you to check out the website link that's listed on this slide, www.carymedicalcenter.org/employment. That is updated every time a change occurs. So look at it anytime. Our application process is pretty simple. The application's right online on this page. Download the application and you can submit any materials to me, Jamie Corrigan, HR Employment Specialist, and you can send it right to my email. If you'd prefer to fax it, you can do that too, or mail it, either way. But all of my information is listed here for you. Okay. And then just join our family. I hope that this presentation was helpful to you guys. I'd be happy to answer any questions that you have right now.
Thanks, Jamie.
Thanks. Have a good day.